Hello, my name is Lauren Bullock, and this is my Ambassador Scholarship video. As a military child, I have lived in multiple states and across oceans, and with every move came the challenges, adapting to a new environment, new people, and navigating new cultures. In turn, I was exposed to new ideas, new perspectives, and I learned to value belonging and connections. Over time, I realized that connections are what makes our experiences richer, deeper, and better. Connections are created when people feel safe, respected, and valued. My understanding of belonging and connections shape how I view social justice. To me, social justice is not about policies or headlines. It's whether someone feels seen in a classroom, heard in a hospital room, or protected in their community. It is about dignity and opportunity. That is why I am drawn to nursing. Nursing is often associated with compassionate care, but historically, nursing has also been a force for social justice and systemic change. For example, Lillian Wald was not just a nurse, she was a reformer who understood how health is impacted by societal issues. She believed that healthcare could not be separated from poverty, housing conditions, labor rights, or discrimination. Lillian advocated for safer living conditions, sanitation reform, and educational access. She recognized that illness is often a symptom of a larger social issue, that they are interconnected. She treated the model for community health. Policies and institutions can either protect people or perpetuate harm. Poverty, homelessness, discrimination, and environmental neglect are not isolated issues. They are interconnected and influence health outcomes in profound ways. At Salve Regina University, I will use my education to examine those systems critically and act within them intentionally. The Mercy Critical Concerns provide a powerful framework for that commitment. In Hawaiian culture, the word aina means land. It reflects a sacred understanding that land and people are interconnected. The health of the environment affects the health of communities. Environmental degradation disproportionately harms low-income and marginalized populations, contributing to chronic illness, food insecurity, and limited access to clean resources. Growing up in Hawaii taught me that sustainability and respect for our earth are not symbolic gestures. They are our responsibilities. At Salve, I will continue to be a good steward and plan to be involved in organizations such as the Pre-Health Club that view sustainability as a public health responsibility. As a minority female who has navigated diverse communities throughout my life, I've experienced the complexity of identity in different spaces. Every new environment required me to listen before speaking, to understand before assuming. That practice of cultural humility is essential in healthcare. Bias, whether implicit or systemic, can shape diagnosis, treatment, and trust. It can determine who feels safe seeking care and who does not. At Salve, I intend to engage in conversation initiatives that promote equity in healthcare. Through clinical experiences and service opportunities, I want to help foster environments where diversity is not simply acknowledged, but valued. As a future nurse, I will advocate for care practices that reduce disparities and ensure that patients feel represented and respected. Beyond awareness, I understand that change requires action. Education must move beyond theory and into practice through advocacy. Advocacy can occur in policy discussions, in community health initiatives, and even in everyday patient interactions. Mercy calls us not only to serve, but to transform. At Salve Regina University, I will use my education to become a nurse who looks beyond symptoms into systems, beyond individual cases to community patterns, and beyond treatment to prevention. I will carry forward the belief that health, dignity, and justice should never depend on race, income, or circumstance. My goal is not simply to graduate as a skilled clinician, it is to emerge as an advocate, someone prepared to challenge inequities, uplift vulnerable voices, and contribute to healthcare spaces where every individual feels safe, heard, and valued. That is how I will use my education at Salve Regina to pursue social justice and advocate for the mercy critical concerns, not only in theory, but in action.